Well, hello, everybody. I'm so excited to get started on our semaglutide weight loss program. This is really one of the most exciting medications that I've come across in my 20 plus years. So I want to get the slides up and running first, and then you'll see me in the corner. Everybody see this? Of course, there's the important disclaimer. This is actually just information. What I'm going to share with you is all the ways that if you qualify, you can go to your regular doctor and maybe see if your health insurance will pay for this. But if not, some other options for you. This is for information purposes only and education. It's free. Please don't use this for diagnosis or treatment options or take this as a recommendation. So you can see all of that down there on the bottom. We would love to get your questions along the way. So why don't you pop into the chat, say hi, and then if you have any questions, we can go from there. Can everybody hear me okay? Well, I'm just going to get started. Doesn't seem like anybody has any issues. All right. So semaglutide is, what kind of medication is it? What are we going to be talking about here? And what is it also called? I know that some people think it's called the Kim Kardashian medication. I know she's been very public and very vocal about using it for her weight loss, but we're going to go over what kind of medication it is and what it does. And how does it work? Who is it for and who is it not for? That's a really important thing. There's some side effects that we need to go over, both good ones. Yes, there can be good side effects and some ones to watch out for. And then how do you get started if you are interested in doing this? So let's dive in. So semaglutide is a type of medication called an IGL-1. The G stands for glucagon, and you might not see that on the internet because Google doesn't like us to use that word for some reason. So, but that's what it stands for, a glucagon-like peptide number 1. And it's technically an incretin, and it mimics our hormones. And so I love that it's mimicking what we have in our bodies already. It's not technically a bioidentical, but I love that it's mimicking what we already have and what's already happening in our body. It's a group of drugs called a polypeptide. All that means is how many amino acids are attached to it. And peptides usually contain 10 or more amino acid residues. So you might hear it called Ozempic. You might hear it called Wegovy. You might hear it called Ribellus. There are several brand name medications, but the ingredient that they're using is semaglutide. So where does it work and how on earth does this medication work and what is it doing? Well, it primarily decreases hunger and cravings. Now, cravings for carbs and sugars for sure. But also I've heard recently from quite a few patients that it actually is decreasing their desire to drink alcohol. So yay, because this medication and alcohol, you really ought not to mix them too much. It works on receptors in your brain and in your intestine. And so it's signaling the body that you're already full. Knocks on your pancreas door and says, hi, you normally produce some insulin and we want you to do this a little bit more. And it lowers your blood glucose levels. In fact, it was first approved for diabetics. And then, like many medications, you go, oh my gosh, people are losing weight. We better investigate this part of this medication. And they found out by accident that it's a great medication for weight loss. It also delays your gastric emptying. So that actually also helps you feel full longer. It is an FDA approved medication. So if you meet the criteria, then you could possibly go to your family doctor and say, hey, why don't you help me get this medication through my insurance? But it's a little bit difficult. So here's what you need to have going on with you. BMI stands for body mass index, and you can actually just go to Google and get a BMI calculator, and it'll ask for your height and your weight and things like that. And then you can get your BMI. And if you have a BMI of 30, then your insurance will likely pay for this medication. Or if you have a BMI of 27 or higher plus an obesity related condition, things like diabetes, high blood pressure, high cholesterol, those kinds of things. It can be used off label. And what we do at BioThrive is we use a medication called semaglutide from a compounding pharmacy, and that is considered off-label. It is not the FDA approved medication, but it is semaglutide, the ingredient that is used. And 70% of Americans are overweight or obese. And we used to think of fat as just like this covering or insulation, but it's actually an organ. It actually produces hormones. It produces inflammation. It converts our testosterone into estrogen when we're men, and it's not a good thing to have too much fat for our health. So to have this be a weight loss drug that actually works is pretty exciting. So who is this not for? Well, people with a personal or a family history of thyroid cancer, thyroid nodules, thyroid tumors. And that's because in the animal model, they did see an increased incident of thyroid tumors and cancers in the animals, not in the humans, but in the animals. Also, if you have a personal history of an endocrine cancer, you are not a good candidate. If you're pregnant or breastfeeding, you're not a good candidate. Or if you're not doing anything to prevent getting pregnant in the next 3 months or want to get pregnant in the next 3 months, this medication actually has a long half-life. And what that means is it hangs out in the body for quite a while. That's one of the reasons that the injection dose is only once a week. So if you're planning on getting pregnant within 3 months, you are also not a good candidate for this. People with a history of pancreatitis or type 1 diabetics, we do not want you to take this medication. Speaking of medications, there's a whole list of medications that it can interact with in a bad way. And so these are called contraindications. So if you're taking these medications that are listed here, and there's some groups of medications like anticonvulsants, tricyclic antidepressants, but examples of that are like amitriptyline, antipsychotics. There's a list of medications that you shouldn't be taking this medication with. Now, some of them are soft contraindications, like a beta blocker. You can talk to us, not just us, with the doctor, schedule an appointment with the doctor and learn about if you're still a good candidate. HIV medications. And if you're taking insulin, we don't want you. And that goes back to if you're a type 1 diabetic. And I know there's a lot of type 2 diabetics that are taking insulin, but the two don't mix. So we often think of side effects as bad stuff that happens, but there's actually some beneficial or possible beneficial side effects, possible benefits that happen and were observed in this medication during the clinical trials. So one of them is it can lower your blood pressure. So that's a good thing, but it also can be not so good if you already have low blood pressure. And so that's why if you're taking some of these blood pressure medications and this lowers your blood pressure, it might be dangerous. So again, just partnering with a healthcare professional to keep you safe. Yes, we talked about the lower glucose. Sugar is about the most inflammatory thing I can think of. And so if we lower the glucose in our bodies, there's a whole host of things that it improves. It improves your cancer risk. It improves your pain, inflammation, all kinds of things happen when you lower your sugar. I mean, sugar is the favorite food for cancer cells. It may lower cholesterol. It may decrease inflammation. These are all the things that they saw and observed in their clinical trials. Improve memory and increase neuroplasticity. Now, neuroplasticity is that part of our brain that's able to make new synapses and learn new things and basically have a young brain. It may decrease risk of certain cancers, but my personal belief is that is really because when you lose weight, you lower your risk of certain cancers. So who knows the real reason there? And it also may decrease your risk of a heart attack or stroke. And this was one of the things that was studied. It did show it decreased the risk of dying from a heart attack or a stroke for patients with diabetes. And it may improve insulin sensitivity as well. And that's also important if you have PCOS. So that's like a double whammy good thing. So the not so great side effects, some of them are mild, some of them are not so mild, and not everybody has them. One of the things that you'll notice about this medication is that it is started off at a low dose, and you do it once a week at 0.25, and then that's for a month. And then you go up to 0.5 once a week, and that's for a month. And then you get up to the beginning of the therapeutic dose, which is 1 milligram. And that's where you really start the weight loss. People in the first 8 weeks may lose some weight, but I don't worry if they don't lose much or any at all. And that's to decrease the risk of these side effects. So if you are one of the few people that do have these side effects, they often go away. And there's tricks that we can help you with. The vast majority of our patients have no negative side effects, but you want to know what's possible, right? So nausea, abdominal discomfort, diarrhea, or constipation, low energy, but that could be from not eating enough or low blood sugar. And in fact, the nausea also could be because you didn't eat. Your body thinks of low blood sugar as a little bit of an emergency, and it makes you feel unwell. Or it could be that you ate too much, that sick feeling that you have after turkey dinner and Thanksgiving. So it could be either of those. Less common, but in more serious possible side effects, we talked about the possibility of the thyroid tumors that they saw in the animal model. Pancreatitis. How would you know if you had pancreatitis? Well, we don't know for sure until you go to the doctor, but typically what happens is you have abdominal pain that radiates through to your back. Retinopathy with patients with diabetes. You can be allergic to anything that you take, whether it's a medicine, a food, or something topical. So there's a possibility of an allergic reaction that might show up as a rash or itching or swelling or, anything that could be possible as an allergic reaction. And you might have a gallbladder attack. Now, we don't again know whether that is because of the medication or whether it's because of weight loss, because that can happen as well when people lose weight pretty quickly. So how do you get started on this medication? Well, it's a prescription, so you got to talk to a doctor. My goal today was to share with you, how can you navigate insurance if you qualify with a BMI of over 30 or a BMI of over 27 plus obesity related conditions. And it's very challenging, to be honest, to get your insurance to pay for it. You can also work with us, and we have a weight loss program, a starter program, and it's 4 months, and it includes everything. So it includes your medication and your insulin needles and your follow-up appointments. We keep track of you every 2 to 4 weeks. So it's a prescription. you need an appointment with a doctor. If you see something online and they're just willing to write you a prescription, run for the woods. Don't do it. And again, at BioThrive, we use semaglutide from a compounding pharmacy, so it's not the FDA medication. If you do meet the guidelines of the FDA medication, you can use your insurance. And we don't do insurance work, but you can go talk to your family doctor perhaps for that. Our program, our starter program, is 4 months long, and that gives you the 2 months to really get that starting dose, to decrease the side effects under your belt, and then get a couple of months under your belt for weight loss. Now you can continue on with the same dose, a medium dose or a high dose, and it's all customized for you. And the usual dose in Ozempic, so they come in like a pre-filled pen, that's 2.4 milligrams. But honestly, out of all the patients that I have one patient who's all the way up to 2.4 milligrams. Everybody else is at 1.5. And why would we use more medication if less is working just as well? Less side effects, less cost, less everything. So that's great. So our program includes an information session, doctor's appointments, 4 months supply of the medication, all your medical supplies, weight loss tips that come in. Did you know that not getting enough sleep is associated with resistance to weight loss, for example? Did you know that vitamin D is linked to not being able to lose weight? So we're going to support you every way. Recipes, and those of you who know me know that I'm married to an Italian and he's a fantastic cook. So I come up with the healthier options and he makes the recipes delicious. So they're husband tested and they're very, very good. And you'll get all your follow-ups and all your monitoring. Like I said, after the program, after the starter program, you can discontinue. You can do microdosing for maintenance, and that's anywhere from using a small dose once a week to, I have patients who are using it once a month. Or if you want to lose more weight, we customize again to what dose you would be doing and what would be best for you. So we work with you every step of the way. Like as you go along, you don't know what you don't know until it bumps you in the nose, right? So you might think, oh, I'm not going to have any side effects. And then boom, you're having constipation. Well, we're going to help you along the way. We're always going to try natural things first. So did you know that magnesium is a fantastic first step to trying to ease the symptom of constipation? So that's something that will help you with. And what's the dose? You know, whatever works. I remember when I was in medical school, the magnesium is mg, and I remembered it as must go. So the first side effect of taking too much magnesium is loose stools. But we really want to support you on the weight loss journey. So let's get down to brass tacks. If you went to the drugstore with a prescription because your insurance said no, you would find that it was $1,300 up to $1,800 for a 1 month supply. And so we're able to offer it a lot less because we're using the compounding pharmacy semaglutide, and we pass that savings on to you. So the program is 4 months in length, $450 per month. If you meet your insurance criteria, we encourage you to reach out to your primary care physician first before reaching out to us, because that would be great. And it's delivered to your door. You don't have to do anything. It's right to your door in less than a week. So if you'd like to get started, I'd like to offer you an incentive. I know that a lot of people have done weight loss programs and it has been successful, but keeping it off is the trouble, right? And so the fact that this medication can be used microdosing long-term is so exciting to me. The other thing I love about this medication is that it works. And I hate that it works without doing lifestyle exercise or really focusing on good food. It actually just works. I wish you'd have to eat like 3 servings of protein and go for a 20-minute walk every day. Of course, if you do those things, you're going to be healthier and it's going to work better, but it actually works. Does it work for every single solitary person, every single solitary time? Nope. Nothing in medicine does, including an aspirin, prescription, surgery. No guarantees, but this medication has been through the ringer with regard to studies, and it has been shown to be very successful in the majority of patients. You can also email us at info@biothrive.health, but in the chat, you'll see a link, and that link can be used to actually schedule a complimentary weight loss info session if you're ready to go or if you have some questions about whether it's right for you. And again, you will meet with the doctor first because it is a prescription, but if you want some more information to get going, wouldn't it be nice to be feeling your best and your most energetic in a body that you love long term, but starting now? So for those of you on this webinar and for the rest of this week, I offer you a $50 discount off of the first month. When you reach out to us, just mention the webinar and we're happy to support you in getting started and having the best new year, right? So if you think about the timing, this is perfect. But this discount is not going to last for long. There's a national shortage of these medications, and so our prices continue to go up. So I don't know how long we'll be able to offer the discount. So give us a call. I'd love to know whether or not anybody has any questions. And if you prefer, I know a lot of people don't like to ask questions in the chat because there's a lot of people watching, then just use the link or give us a call. We're open from 8:30 a.m. until 7 p.m. Monday through Thursday. We do have appointments on Fridays for appointments, but you can schedule it or just call us. You can call us tonight, 206-403-1223. It is my privilege and my honor to help you on your healthcare journey. And weight loss is just part of it, but I'm excited to bring this tool to you so that you can be the CEO of your own health. Thank you for being here and have a beautiful evening.